Hi again, this is Jim Rush, and last time we spoke about the Hospital Command Center, and now we're going to talk about the Plant Operations Annex. The plant engineer or the director of plant operations is really the expert in all things related to keeping the physical plant of the hospital and any auxiliary buildings on the campus, and maybe even external to the campus, in operation before, during, and after a disaster. Lots to this, and I won't get in the weeds, but I think just to know that there's a National Fire Protection Association, NFPA, that is basically the Bible for facilities, and they go into specific healthcare facilities, life safety codes, and other things that all have to do with the plant operations. The plant engineer or the director of plant operations should give a briefing to the emergency operations, the emergency preparedness council rather, or whatever other committees that you have in the hospital that have to do with emergency management. The plant operations director really needs to make sure that everybody has an understanding of what's going to happen during the disaster and how things are going to occur. The major task, of course, is to keep your hospital open and functional during and after disasters. One of the most important things in that annex, plant operations annex, is to control the entrances to your hospital. There should be a central point of entry, and before you get into the hospital, you need to have a decontamination point. Some of the newer facilities build in a room that's typically adjacent to the emergency room, and the people get, if there's any sense of contamination, and that can be a chemical agent that's used as a terror weapon, or it could be fertilizer. If fertilizer it pours over a person who's a farmer or whatever, that person's going to need to be decontaminated and quick. Anyway, the plant operation annex will discuss all of that. Many hospitals purchase decontamination shelters during the early days of the grant program from 2002, and I think I left in 2007. Anyway, a lot of good equipment was purchased from it was called the National Bioterrorism Hospital Preparedness Program. Today it's known as the Hospital Preparedness Program, and it's still out of the Department of Health and Human Services. In the Plant Operations Annex, there has to be a discussion on the hospital standby generator, and here's one of my favorite issues here, because we've seen where, like in Hurricane Ike, I had a chance to go down to Galveston after Hurricane Ike passed through as the medical specialist, medical equipment and supply specialist, I should say, and they lost generator power pretty soon, and that caused the hospital evacuation. If you don't remember anything else I ever say, remember that the evacuation of your hospital is truly a last resort. There are hospitals that are along the Gulf Coast, and I don't want to name any on this presentation, but I know the hospital associations should point to those hospitals that remained in operation during disasters. It really is a wonderful thing, and they should be recognized for that. The American Hospital Association would be a perfect place to put out the success stories, and they may have already done it, I just haven't seen it, and that's possible. But there are hospitals who have weathered the storm, kept the patients cared for, kept the staff there, and carried on activities throughout the worst of times, and got to tip your hat to those kind of organizations. One of the things that I've been hoping that we can see, and I'm not sure where we're at with that, but jurisdictions need to have backup power systems. Not so much a power generator like you're used to hearing about. It's a backup standby generator. I'm talking about a hospital. I'm talking about a power production system, typically on a flatbed truck, and they're huge, and they can power a whole hospital, a medical center. And I'd like to see each jurisdiction, major jurisdictions like New York and Los Angeles and other places that are large cities especially, have at least one of those. And I will always remember Superstorm Sandy, where I saw nurses coming down the steps of darkened stairwells with infants. And I don't want to point to any hospital. I think I know which one it was, but anyway, there was a number of hospitals in New York that had to evacuate. And talk about opportunities for improvements. If you can stay operational throughout a disaster, especially something like this, like Hurricane, I keep saying that, Superstorm Sandy, there's some hospitals that remained operational, and that was great. But unfortunately, I'll never forget that scene of people nurses walking down darkened stairwells with infants in their hands. My goodness, in their arms. Back to the Plant Operations Annex again. If you can get the jurisdiction to purchase one of these systems, just in case a hospital's generator goes down in the middle of a disaster, I think that would be a real good step forward. And we're talking about infrastructure and infrastructure support. I could see that being an initiative that would be reasonable. You know, you're talking New York or Philadelphia, you might be talking about 2 or 3 such systems. And then of course you have to make sure that you have the wiring harnesses that would connect between that mobile, call it a flatbed power production unit, and the hospital that needs power. So you'd have to make sure that the hospitals that you could plug into have all the proper wiring harnesses and connections. The Plant Operations Annex also needs to talk about generator fuel, how the generators will be fueled during disasters, medicinal gases, how they'll be resupplied, and a big one is water, how the hospital will get both drinking and washing water. And they call the drinking, you'll hear it called potable water, which means you can drink it. And the washing is just not suitable for drinking, but it is fine for taking baths and other things that you need for your patient. The Plant Operations Annex also needs to discuss waste disposal, on-site waste sterilization when possible. When not, how you're going to store your medical waste until a medical waste company can get there and transport it for you. It's important that you have systems in place so you don't have a contaminated area. I'm a fan of on-site sterilization, and the idea, and this is important too, I think, is if it's your medical waste, you're responsible for it until it is rendered safe. And so if it's being transported across the highways and byways, that's still your waste. A lot of people don't know that. The Plant Operations Annex also needs to talk about the security of the hospital during disasters, the lockdown, where the entrances are for the patient entry, single point of entry, and staff, where they can come into. And basically, I like the idea of door monitors, and the Plant Operations Director can work with Human Resources. So when a new employee comes in, they get an assignment, whether they're on a treatment team or they're in a security team, or in the case like a facility team, it might be a door monitor. They also need to have, the plant operations director also needs to discuss the press corps waiting area, family bulletin board for updates on the family members. They need to work with human resources for daycare centers. We'll talk some more about daycare centers. That's a big item, because we're talking about a lot of people in this world are single parents. And that means a lot of healthcare providers are single parents. And if you don't have a way to secure my children and let me have it when I go off duty, for whatever period of time that I'm allowed to go off duty, I can go over and see them and be with them and console them. And if I don't have that, then I'm probably not going to be sticking around. That's a hard, cold fact. It has to be worked. And what I would recommend you do is work with companies that provide daycare services on a routine basis, and ask them if they'd like to be your expansion daycare provider, and put basically a daycare center either in or near your hospital. I should say near your hospital, but away from the patient treatment areas and any decontamination areas, of course. But basically some place close, so the care providers and other hospital personnel have a place to go to be with their family when they are having any downtime. And then, of course, any other campus buildings or off-campus buildings need to be discussed in the plant operations annex, and it has to be discussed in terms of what their functions will be during a disaster. Well, that about does it now for the plant operations annex. The next one we'll be human resources. Thanks an awful lot for tuning in. There's the subscription button down below. If you press that, they tell me that you'll have access to each and every one of my YouTube videos. And thanks an awful lot. Take care.